Hey guys, and welcome to today's video on stroke. Stroke, or a cerebrovascular accident, is defined by the World Health Organization as a neurological deficit that persists beyond 24 hours or is interrupted by death within 24 hours. A neurological deficit refers to an abnormality of a body area due to weaker function of the brain, spine, nerves, or muscles, such as the inability to speak or decreased sensation. A cerebrovascular cause simply refers to the brain and its blood vessels. The time 24 hours has been included in the definition because that's what separates it from a transient ischemic attack or a mini stroke, which is generally resolved within the 24 hours time frame. There are two main types of stroke: ischemic and hemorrhagic. An ischemic stroke occurs due to obstruction of a blood vessel. The Stroke Association state that this type of stroke is the most popular as it accounts for 87% of all stroke cases. If we are to dwell deeper into ischemic strokes, we can find two subtypes: thrombotic and embolic. A thrombotic stroke occurs due to an accumulation of plaque resulting in obstruction of the vessel. An embolic stroke occurs due to a piece of plaque breaking and lodging itself in one of the blood vessels near or in the brain. Conditions caused by ischemia occur all around the body. For example, a deep vein thrombosis or a DVT. This is obstruction of either the femoral or popliteal vein. Myocardial infarction or a heart attack. So this is obstruction of the coronary arteries. These are the heart's own blood supply, helping it to pump blood all around the body. And also pulmonary embolism, which is the blockage of an artery supplying blood to the lung. The second type of stroke is a hemorrhagic stroke, and this can also be split into two: cerebral stroke or intracerebral hemorrhage and subarachnoid hemorrhage. A cerebral stroke occurs within the brain itself, and a subarachnoid hemorrhage actually occurs in the space between the skull and the brain tissue. This type of stroke occurs when an artery supplying blood to the brain ruptures or bursts. So what are the signs and symptoms of having a stroke? The FAST acronym is internationally known for the general public to recognize symptoms of someone having a stroke. F for facial drooping, A for the reduced ability to raise one arm, S for slurred speech, and T for it's time to act, call 911. This acronym works really well because it's catchy and it's very, very simple to remember. However, not everything's perfect. There are 5 main symptoms that you should look out for, and FAST only accounts for 3. The 5 are sudden numbness, sudden confusion, sudden vision impairment, sudden loss of balance or coordination, and a sudden headache. Researchers found that by only looking for those 3 symptoms rather than the 5 actually resulted in 8% of ischemic strokes and 30% of hemorrhagic strokes being missed. The performance of the acronym fell as numbness was not included. It caused a rise in stroke cases missed, with the effect being greatest for transient ischemic attacks or mini strokes, which is generally when it's the most crucial time for prevention. Different abilities are affected after having a stroke, such as movement or speech, because they are allocated to different areas in the brain. When blood supply is reduced to these areas, brain tissue death occurs, which destroys the synapses, allowing us to perform these movements, resulting in physical, psychological, and social complications. So why does a stroke occur? To answer this simply, I'm going to explain how ischemic and hemorrhagic strokes occur. In an embolic or thrombotic stroke, a blockage occurs in the blood vessels. The blockage can occur by either a fat globule, air gas bubble, or foreign material. The most common material that causes an obstruction is called plaque. This is formed when there is damage to the endothelium of the blood vessels, which is generally caused by high blood pressure, high levels of cholesterol, or smoking. This is a process called atherosclerosis. The difference between the two is that a thrombotic stroke occurs and is formed locally, and an embolic stroke occurs when the clot travels and is too big to pass through the vessels. In a hemorrhagic stroke, bleeding occurs within the skull. They occur due to changes in the blood vessels in the brain. This can be caused by either cerebral amyloid angiopathy, which is when amyloid is deposited into the blood vessel walls, making them weaker, or either cerebral arteriovenous malformations, which is when there's an abnormal connection between the arteries and veins. Normal blood flows from the heart to the arteries, to the arterioles, and then to the capillaries. However, when there's an arteriovenous malformation, the blood flows directly from the arteries to the vein, or an intracranial aneurysm, which is weakness present in the blood vessel walls, increasing its risk of rupturing. So that's it for today, guys. Be sure to comment below, leave a like and subscribe. Take care, and I'll see you later.